Welcome to the revision of the abdomen. At first, listen to the voice of the slides and then repeat the presentation with the voice down, so you will try to identify the slides yourself. At first, we will start with the anterior abdominal wall. This is the external oblique muscle. The internal oblique, notice the direction of fibers upwards and medially. And this is the transversus abdominis. This is the rectus abdominis muscle. And these are the tendinous intersections of the rectus abdominis. This is the anterior rectus sheath. This is the posterior rectus sheath. And this is the arcuate line at its lower border. The inguinal ligament, the lacunar ligament, the superficial inguinal ring, the spermatic cord. Now we will study the abdominal cavity. This is the stomach, the greater curvature, the lesser curvature, the cardia, the fundus, the pyloric canal, and the pylorus. This is the greater omentum and the lesser omentum between the stomach and liver. This is the opening to the lesser sac or the epiploic foramen. This is the first part of duodenum, the second part of duodenum, and the third part of duodenum. These are the loops of small intestine, the jejunum and ileum. This is the cecum, or the first part of the colon. This is the vermiform appendix. This is the ascending colon. The transverse colon. The descending colon, and the pelvic colon or sigmoid colon. This is the left lobe of the liver. This is the right lobe. This is the quadrate lobe. And this is the caudate lobe. This is the inferior vena cava, and this is the gallbladder. This is the porta hepatis. This is the portal vein passing through the porta hepatis. The hepatic artery. The common hepatic duct. The cystic duct, and the common bile duct. This is the falciform ligament of the liver containing the ligamentum teres at its lower border. These are the coronary ligaments. This is the right triangular ligament connecting the right lobe of liver to the diaphragm. And this is the left triangular ligament connecting the left lobe to the diaphragm. This is the fissure for ligamentum venosum, fissure for ligamentum teres, papillary process of caudate lobe, caudate process, area of quadrate robe related to the lesser omentum, area related to the pylorus and first part of duodenum, area related to the transverse colon. This is the esophageal notch related to the esophagus. And this is the area of the left lobe related to the fundus of stomach. This is the gastric impression on the left lobe of the liver, and the tuber omental related to the lesser omentum. This is the bare area of the liver, the upper layer of coronary ligament, the lower layer of coronary ligament, the right triangular ligament, the duodenal impression related to the first inch of the second part of duodenum, the colic impression related to the right colic flexure, the renal impression related to the right kidney, and the area related to the right suprarenal gland. This is the pancreas. This is the head of pancreas, the uncinate process, the neck of pancreas, the body, and the tail. This is the spleen, and this is the gastrosplenic ligament between the stomach and spleen. This is the celiac trunk. This is its first branch, the left gastric artery. This is the second branch, the splenic artery. And this is the third branch, the hepatic artery. This is the hepatic artery proper. And this is the gastroduodenal artery. These are the right gastroepiploic vessels, the left gastroepiploic vessels along the greater curvature of the stomach. This is the right gastric artery along the lesser curvature of stomach. And this is the left gastric artery. This is the superior mesenteric artery. These are jejunal and ileal branches arising from its convex side. This is the first branch arising from the right side, the ileocolic artery. This is the right colic artery and the middle colic artery. And this is the inferior mesenteric artery. This is the superior mesenteric vein and splenic vein. And here is the portal vein. This is the hilum of the right kidney. This is the renal pelvis. And this is the ureter. These are major calyces in the sinus of the kidney. And these are renal papillae, or the apices of the renal pyramids, which are surrounded by minor calyces. Here are the two suprarenal glands, right and left. This is the abdominal aorta. This is the median sacral artery, the right common iliac artery, giving internal iliac branch and external iliac branch. This is the circumflex iliac branch of the external iliac artery. And this is the second branch, the inferior epigastric artery. This is the inferior vena cava. receiving above here the two hepatic veins. Now we will see the nerves of the posterior abdominal wall. This is the subcostal nerve, the iliohypogastric nerve, the ilioinguinal nerve, the lateral cutaneous nerve of the thigh going towards the anterior superior iliac spine, the femoral nerve in the groove between the iliacus and psoas major, the genitofemoral nerve in front of the psoas major muscle, and the obturator nerve emerging from the medial aspect of the psoas major. Now we will see the muscles of the posterior abdominal wall. This is the psoas major. This is the iliacus and the quadratus lumborum muscle. Now we will have a revision on the pelvis. This is the pelvic inlet or pelvic brim. This is the obturator foramen, the ischial spine, the ischial tuberosity, the pubic bone, the conjoint ramus of pubis and ischium, or the pubic arch, the symphysis pubis, the sacrotuberous ligament, the sacrospinous ligament, the greater sciatic foramen, and the lesser sciatic foramen. Regarding the muscles of the pelvis, this is the piriformis posteriorly, the obturator internus on the side, the coccygeus posteriorly, and the levator ani making the pelvic floor. Regarding the vessels, this is the internal iliac artery. This is the continuation of its posterior division, the superior gluteal artery, passing between the lumbosacral trunk and S1. This is the inferior gluteal artery which arises from the anterior division, passing between S1 and S2. This is the internal pudendal artery, and this is the obturator artery. This is the sympathetic chain descending in front of the sacrum on the medial side of the anterior sacral foramina, from which the roots of S1 to S4 emerge. Regarding the organs of the pelvis, posteriorly is the rectum. Here in the male, anteriorly, we see the ureter, ending in the urinary bladder. Below the bladder is the prostate gland. In front of the prostate is the symphysis pubis. This is an opened urinary bladder showing the two ureteric orifices and the internal urethral meatus. On the back of the urinary bladder, this is the ampulla of the vas deferens, and lateral to it, on each side, there is a seminal vesicle. Again, this is the urinary bladder. This is the prostatic urethra running inside the prostate. This is the ejaculatory duct, which joins the prostatic urethra from behind. This is the membranous urethra, which lies in the perineum. And this is the penile urethra running in the corpus spongiosum of the penis. These are the components of the female genital system. This is the uterus, the vagina, the ovarian ligament, the ovary, the fallopian tube, its fimbriated end, and the round ligament of the uterus. Notice that this view is posterior view. Now I wish you all the best of luck.